I have a question for you. What really is snoring? What causes a person to snore? And let's get real. Snoring can be challenging on relationships and can create big problems in your health. Hi, I'm Dr. Jill Wade, and welcome to the Beyond Face Value Show, where we dig into topics that are designed to improve your health, your money, your mindset, and so much more. It's my pleasure to introduce to you my guest host, health and beauty expert and author, Laura Lewis Edwards. Welcome.
Thank you, Jill.
Thanks for joining me
happy
today.
To be here with you.
No, thank you.
Yeah.
In this episode, we're going to be talking all about snoring, what causes it, the problems that snoring can create in your life and your health, and we're going to talk about some real solutions for snoring today.
Yeah, I can't wait to hear.
I know. So, Laura, I'm going to put you on the spot for a second.
Okay.
Do you snore?
Well, let's see. I don't know because I'm sleeping. No, I'm kidding, but I do know, and I have been told, yes, I do. I've started to snore over the past couple of years, but I'd love to know really why. I know we're going to be talking a bit about that, and I'll share with you a little later. I have a little trick that I do that can help me stop snoring.
Nice.
Yeah, it's not exactly a permanent solution, but I think you're going to like it.
Wonderful.
Yeah.
Thanks for sharing, Laura. I know this. I sure do. And so this subject is very near and dear to me because I love sleeping in bed with my man. And when I am snoring like crazy, guess what? Either he or I are going out of the room. So this is happening all over the country. People are just not staying connected in the bedroom if one person is having to leave and go somewhere else.
Yeah, that's not good for long term.
It's not. The crazy thing about snoring is it's really just the first sign or symptom. There are so many other breathing and sleeping issues that I know for a fact in future episodes, we're going to be talking a lot more about snoring, a lot more about breathing, and a lot more about sleep.
Yeah.
And why? Because breathing is essential.
It keeps
I mean,
us alive.
It's essential. So let's dive in.
Yes.
What causes snoring and why do some people snore and other people don't? So a lot of people don't really know the anatomy of the back of the throat and soft palate.
Right.
So the reason that a lot of people snore, and I'll show you kind of a picture of the inside of a mouth,
Okay.
you can see that there are areas in the back of the throat where you can actually see where our food goes down and where we swallow. But if you can also see, there are a lot of other anatomical spots around it that are soft and mobile. And so when we are breathing, anything that's maybe too mobile or too flappy is flapping around in there and making the snoring noise.
I've never really thought about it that way before.
Yeah.
Flapping around.
Flapping
so
around.
I want to know more.
Exactly. So a lot of treatments will identify kind of where those issues are with the movement of those soft tissues and somehow treat those. And we'll talk about some of those solutions here in a few minutes.
Okay.
But what a lot of people don't understand is snoring can also be caused by obstruction in the nasal cavity. Because remember, we're supposed to actually be breathing through our nose, not our mouths. Breathing through our nose is much healthier for us.
I've heard it's better for oxygenating the blood through your nose versus breathing through your mouth. And
Better healing,
yeah,
better restful sleep.
right.
That's at night when we process. So we kind of wake up feeling more
Refresh?
refreshed
Okay.
and feeling actually a little less stressed.
Okay. Because sleeping with your mouth open, which I don't know anything about that. Sleeping with your mouth open, your mouth gets dry.
Yes.
And it just doesn't seem like it's the right thing. And so I'll share with you a little later how I fix that problem.
I love
for
it.
me.
I love
So,
it.
Yeah.
So in our office, sometimes as much as we want to go inside the mouth, and obviously I'm not an ENT specialist, but we as dentists, we have to also think about, well, what's happening in the nose? So in our office and in many offices now around the country, we have something called cone beam technology, and it's a certain type of x-ray that adds a third dimension to things. So you can sit in the x-ray machine, you can go around, and guess what? We then get to see in an x-ray format all of this aspect of the face where we can actually look and measure people's throats, how big they are, and if the throat itself is being constricted because of large tonsils or adenoids.
Right.
And then we can also look at the nose, the bony aspects of the nose, and identify when there's a deviated septum or a polyp or turbinates. We won't get into all that too much,
okay.
but something that is creating so little space in the nose that you literally can't breathe through it.
So about cone beam, because I've seen this before, I know that the cone beam is, as you were showing the people that are watching, also the people that are just listening, this is something that goes completely around the head, like 180, I guess, 180 degrees, and it looks at soft tissue as well as the bones, right? Because which is really different than what a lot of people are used to with x-rays, right?
Correct.
So when I saw that for the first time, I was amazed what you could see.
I have this happen all the time at the office. People come in for snoring, and just through our diagnostics, our thorough diagnostics, we're able to tell them so much more information about what's really going on with them than they've even been told seeing an ENT or seeing their general physicians.
Wow.
So I love that dentistry is going to be a huge part or piece of not only snoring, but sleep and breathing.
Okay. Yes. Very good.
So what other kind of health problems does snoring cause in the short term and the long term? We know, we just kind of mentioned it a second ago, fatigue. If you're not sleeping well,
right,
you're going to wake up feeling so exhausted and fatigued. And you and I've talked multiple times about what that does to our bodies.
We have.
Increasing the cortisol. Increasing cortisol typically does what?
Makes you gain weight.
Makes
I know.
us hold on
That's
to everything.
that belly fat,
Yes.
cortisol, higher cortisol, more belly fat. Yeah.
And what happens is our bodies think that we're in survival mode because we aren't getting enough sleep and restful sleep. So guess what it does when we're in survival mode? It just holds on to it.
Yeah.
So you can be doing the best diets, you can be working out as much as you want to, but if you're truly having some breathing and sleeping issues, snoring being one of the first signs or symptoms, you're not going to get the results that you're looking for.
Right. Yeah.
So I'm a big believer in just always thinking about the root cause of what is happening. And if you can go and identify the root cause of the problem, which might be an obstruction, then that is where I encourage my patients to go and take care of. Because when you take care of a root cause, you're actually going to get long-term results.
Right. And this is where you remind me about really what you're about, which is this wellness aspect of all that you are. I mean, hence why you want to host this podcast, talking about every aspect of the body. You don't just, with your dental training, go in and just look at the mouth. You know, now we know that all of these things are associated with our total health. But I love that about you, is that when you see each and every patient, or you just meet somebody that you want to talk to about issues like, I don't know why I'm, can't lose this belly fat. You're automatically thinking, well, it could be this. Yeah, right, exactly. Absolutely. So looking at the total picture,
and
I love it.
There's so much to do with sleep. Like I said, there can be hormones that are out of balance. There can be stressful issues that need to be resolved. So much, and we're just, really just like I said, just kind of peeling off the first layer of this today.
Yeah.
You may already be thinking about what the solutions are, but first let me share this one statistic with you. Did you know that snoring is one of the top 3 reasons that people get divorced? Divorce, it can be costly. We are always talking about what's the cost of doing, let's say, some treatment versus the investment of doing the treatment versus the cost of not doing it. Well, I don't know about you, but divorce is pretty costly.
Yeah. Yes, I know. I've heard, and I think I've experienced that before.
So if it's the top 3, then I always am like, okay, well, what's number 1 and number 2?
Yeah.
Financial stress and infidelity. So to me, snoring is right up there with those 2 things.
So let's say that again. So the top 3 reasons.
Infidelity,
the people get divorced.
financial stress,
and
snoring is number 3.
Isn't that crazy?
Crazy.
That's crazy. That's a really interesting statistic, and that people will be like, paying close attention now, because it does, as you said earlier in this episode, about impacting the sleep even in your life, I mean, right? I mean, you want to stay there with your man.
I do. I do. So let's talk about solutions. In our dental practice, we use a laser called the Solea, and it allows for us to go inside the mouth back to where we were talking about earlier, where the tissue is soft and moving. And what we do is we gently traumatize with the laser that area. It reaches into kind of the deeper layers of the tissue, slightly traumatizes it, and over the next 20 to 30 days, actually allows the collagen fibers to re-heal. And when they re-heal tighter. And because they're tighter, it actually shrinks, some of the soft tissue and opens up the back of the throat where there's more room to breathe and less things to flap around.
That is so fascinating, but it makes perfect sense.
It does.
And this laser, does it hurt?
That's a great question.
Okay.
This is what I love about it. It's very uninvasive, if you want to say. A lot of treatments that they've used in the past to help stop snoring with a laser were very invasive.
Okay.
They were literally cutting off some of that tissue. So it would feel very sore, be very painful, almost, like a tonsillectomy type of situation.
Wow.
And what would happen is if they still actually had nose issues, an obstruction, there was still noise. People got very frustrated. They did all this, they spent the money, did all the surgery, and really they just changed the noise. It didn't really silence the snoring. So we love this in our practice. And what I also love about it is it's very affordable. 2 treatments is what most people will need. And around the country, the average is about $600 to $800. If you have, let's just say it's been going on for a little bit longer and we have a little bit more issue in the mouth, it may take 3 to 4 treatments.
Okay.
They are spaced out about 20 to 30 days from each other. But the great thing is you can come in the morning, it takes about 15 to 20 minutes for the procedure itself, and then you can go right to work.
Oh, I just love
You
that.
can eat everything normal like you were going to eat that day. You go to work, you can go work out. There's really no downtime. You just simply feel like if you had a cup of coffee, maybe it was a little too hot and you drink it a little too fast, the back of the throat is just irritated.
And when you mentioned traumatizing the tissue, and I know that could be a scary word, but really what you're talking about is just kind of, like you said, going in, heating it up a bit, stimulating that collagen so it gets tight. So I want to make sure I understand this, gets really tight, flattens things out so you're not going to make as much noise. It might take a few more for some people than others, right? And then also just, I was wondering, what are some other things that people do for snoring that aren't necessarily the most successful long term? What are some options that some of our, the viewers or listeners might be trying?
A lot of times with the patients that come in, we talk about so much different aspects to it because it is multifaceted. It's not just one thing and it's not just one solution. But a lot of my patients, if they've ever used nose strips before, some people love nose strips. They're very inexpensive. You can go buy them right now at, any of the drugstores and try the nose strips, which are from the outside going to kind of help support and open up the nose for better breathing.
Okay.
There are also inside the nose supports, and they kind of just look like little loops with little circles. And you would think, surely that can't help. But believe it or not, it does. Just helping something kind of open up the nasal passages and allow the breathing to occur more naturally through the nose rather than all through the mouth. Simple things like that work. So what is your
I
little,
know.
what is your
I was
little
waiting
trick?
for you to ask
I want
me.
to hear it.
Well, you might have heard this before, mouth tape.
Mouth tape.
I saw it, where do you think I saw it? On social media. I thought, well, I wonder if this really works. And I actually had done some research because I'd had to go to, had an upper endoscopy years ago and had some issues. And it turned out it really was, I was just having some issues with reflux and all that from snoring, sleeping with my mouth open. So I just taped my mouth shut along with, I do wear my night guard every single night. So I look real pretty when I go to bed with my night guard. I say
Hey,
to
the lights are
I say to my
right?
husband, I go, okay, I'm gearing up, and put the mouth guard in, and then I put the mouth tape on. And I have to say, it does work. I mean, I'll say, did I snore last night? Well, you didn't snore, but you made a funny whistling noise or something like that. But it really has helped keep my mouth closed. I really would love to explore with you to see if I'm a candidate for the Solea laser, just to see if I am.
Well, you're giving me a great idea. There is so much information out there right now about nasal breathing versus mouth breathing. I think that needs to be a future episode that we talk about because there's so many health benefits if people understand how to breathe properly. Yes, I love it. So I think we can both agree snoring is just not sexy. And we want to educate, everyone that's listening on how to restore healthier and happier bedrooms
Yes.
for all of us, right?
Yes.
Good. This concludes our episode all about snoring and what to do about it. On the Living Beyond Face Value podcast. Thank you, Laura, for being my guest and co-host.
I have been.
It's been a
such
lot of fun.
I've had a lot of fun with you.
Yes. I wanted to also thank you, if you're watching or listening, for being part of our podcast today. It's my hope that in some way what we shared today has improved your life or the life of someone that you're maybe sharing a bed with. I would also appreciate it if you would share the link to our show with your friends. Don't be silent about snoring. Be loud about this one, okay? Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platforms such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.